You've seen the power of the body work, how little I had to do. I'm always amazed, even when I do it myself, at what kind of responses I get from people. How powerful it is to just rub the body in a few of the right ways, and the way it can change the circulation, the temperature of the body, move that blood and stimulate the nerves. But there's even a greater way, a more powerful way to do that. It's called hydrotherapy. Hydro just means water, so really what we're talking about is water therapy. All the natural healers of old used hydrotherapy in their clinics, along with the herbs, along with the foods, along with all the programs to stimulate the great healings that you've heard about. You know, nowadays people swallow a few herb capsules and expect a miracle. It doesn't work that way. Sometimes it takes a lot of dedication and a lot of hard work to be well. And hydrotherapy has to be part of everybody's program, and especially a part of the Incurables program. John Harvey Kellogg of Battle Creek, Michigan, he cured the incurables using water therapy, whole foods, and body work. The power of the body work and the water therapy. There was a doctor named Benedict Lust who came over to this country from Europe. Benedict Lust had a method he called the blood washing method, where he kept you in hot and cold applications for 8 hours straight. You can imagine the power of that. Here's a book that I brought here called My Water Cure by Father Sebastian Knipe, written in the late 1800s. This book is not only an herbal, it contains many pictures of herbs and how to use them, but these old herbals contain something else. And as you can see in this book, they contained all types of water therapies. How to apply the water, what temperature of the water to use, where to put it on the bottom picture up and down the spine. And there's even more pictures on every page of various applications of hot and cold water onto the body and how to use it. So that's what we're going to go into next, hydrotherapy. You know, a few years ago I went down to one of the last operating hydrotherapy clinics in the United States. I thought I wanted to experience the great old treatments that were in this country years ago. When I walked up to this clinic, what did I see? The last clinic that was open, out of 12 that were there, only one was left, and there were elderly people sitting all over the porch with their heads down, almost drooling on the floor. And I thought, oh no, this is a sanitarium. Well, I want to see it anyway. So I went in, I said, give me the full hydrotherapy treatment. What did they do? They put me in a hot tub, made me drink hot water. Then they took me out and put me in a shower, and cold water jets hit me all over the body. Then I went into another hot tub and a steam bath. Then they put me in a room and they put hot packs and ice packs all over my body. They finally put me in a wheelchair where they wheeled me out to the front, where I sat just with all these other people staring with a drool coming out of my mouth, and I realized there was nothing wrong with these people. That was just the power of hot and cold water and how it affects your body, your mind, and your spirit. You know, these spas still operate all over Europe, in Belgium, in Luxembourg, in France, in Germany, even in England, even in what we could say conservative England. They have hydrotherapy spas everywhere. The bottom line, we all need to include the applications of hot and cold in this program. Why? Because hot and cold dramatically move the blood more than anything else you could do, more than body work. Hot water sedates you, relaxes you, and while it's relaxing you, it relaxes your muscles. Your muscles loosen up, and it also brings all the blood in your body to the very surface. That's why your skin turns red. Cold water does just the opposite. It stimulates you. It contracts the muscles, and it drives all the blood that's on the surface of your body into the deeper organs. By changing from hot to cold, and by hot to cold again, you bring the blood to the surface, you drive it to the center, you're moving that blood through the body. It is dramatic, as you're going to see. But first, there's one first step before we start any hydrotherapy program. It's called plastic. Make sure that you cover your bed, you cover the floors. You're going to see us in a minute. We're going to put plastic everywhere. It's very important because many of the therapies coming up will wet your mattress, will wet your floor, but they'll also stain because we're going to mix herbs with them. So what we're going to do now is put that plastic down. Okay, we've talked about hot and cold showers. Now let's do some. Everybody's got a shower. This is the first place to begin. I have Hillary in the shower here, and normally you'd want to take a minute or two between hot and cold repetitions, but we're going to do it a little faster. Make sure, like Hillary has, that you get your head under the water, that you get it running down your spine, and that you take that shower about as hot as you can stand it. Now we're going to have Hillary turn the water all the way to cold. And believe me, we're in the wintertime here up in the mountains of Virginia. This water is cold. And you'll see what happens is when you get into the cold water, you have involuntary breathing. Okay, it makes you hyperventilate. Okay, it contracts your diaphragm. It forces you to breathe. This is wonderful. We're getting more oxygen in. Okay, now let's turn it back up to hot. We're repeating that. You notice her skin went white where that cold water hit. The hot water brings the blood to the surface, relaxes those muscles, and sedates you. Now we'll go to the full cold again. Big breath. Take a breath, Hillary. Good. Yes, and you can see the change that it makes. That cold water now stimulates her body, takes the blood, and moves that blood deep within her body and contracts her muscles. Now, Hillary, just go ahead and enjoy a nice warm shower. Many people are concerned, can I do this on the elderly? Can I do it on small children or people with sensitive skin conditions or a weak heart? Of course, but just use your common sense. Start with just cool and warm changes in the water, and after a week or so, when those people are used to it, you can go to the more extremes of the hot and cold, especially because they'll be healthier then. So don't worry about it. Get them in the shower and get the temperature changes happening. Now, what's very important is that we massage the areas, the troubled areas. If you have breast cancer, do the hot and cold right on the breast and make sure that you massage that breast well. If it's a hip problem, get the hot and cold on that hip. If it's your ovaries or your bowel, let it be on your abdomen. Make that hot and cold specifically on the area where you're having a problem, where you have a tumor, where you have your cancer, where you have your disease, and make sure you massage that and do the hot and cold right on the area. Okay, now you've seen what water can do when used on the outside of the body, how it stimulates the circulation. But hydrotherapy is also all about using water to clean the inside of the body. And one of the greatest internal cleansing hydrotherapy treatments there is an enema, or what we might call a high enema, and that's what I'm going to explain now. If you can see on Hillary, I've painted a picture of the colon, and I'd like to go over that a little bit so you get an idea of how big that colon is and exactly where it is. This arrow right here points to what's called the ileocecal valve. The ileocecal valve is where the small intestine, the ileum, the last part of it, enters the cecum, which is the first part of the large intestine. And that's what the C stands for right there. That's the beginning part of your large intestine, also called the colon. This little black area here is the appendix, which is a small immune aggregation that attaches to the bottom of the cecum. It's designed to pick up any bacteria, fungus, or parasites that may enter the large intestine and then enter immune cells into that colon to clean it out and fight that bacteria. We have the ascending colon here, where the colon moves up, and it actually goes right up under the rib cage on this side, about an inch. And this is called the hepatic flexure just because of its location near the liver. As the colon goes across your body, this is called the transverse colon. This area here is the splenic flexure, or the turn right near your spleen. And as it goes down, this D stands for the descending colon, the S for the sigmoid. It has a trap here, almost like the trap under your sink at your house, and then goes out to the rectum and out. you can get an idea here how big this colon is and how important it is to keep it clean and how much waste it can actually store. Okay, now you don't have to know the anatomy of the bowel, the physiology of it is. You don't even have to know the names of the parts. I just wanted to show you where it is, and then we're going to begin a high enema. What a high enema is we're cleaning out not just the rectum, but the entire bowel. We're going to introduce water over a series of enemas all the way to Hilary's cecum and get everything out of there. And this is going to be the first step in the next hydrotherapy treatment we're going to do. But this is something that everybody should know how to do in every family. People call me, what about appendicitis? You want to know the first thing to do for appendicitis? Do a high enema and stop eating. In fact, anytime you're sick, the cold, the flu, whatever, a great way to start is to stop taking food in through the mouth and get whatever waste in your body is out. That's one of the greatest first steps towards healing yourself. So what we're going to do next is we're going to introduce water into her whole colon. Okay, we're about to give Hilary an enema. Again, this is not a big deal. If you want to see big deals and radical treatments, I suggest you take a tour through the hospital. This is an enema. It's a simple technique. There's many different types of enema kits. This is probably the one that you see most often in your store. It can be used as a hot water bottle or an enema bag. But being that it's closed, you have to stop, open it up, refill it. This is an enema kit here that I brought from Italy. This one has an open top. It's much better because we can refill it as we need it without having to stop the process. This bag here, if you have one at home, you may want to cut a hole in it. Cut a hole in the top and modify it so you can keep adding water while you're giving the enema so you don't have to stop the process. Another thing, you can't do an enema on yourself. It's even hard for one person to do an enema on you. So this is a family event. You have to have more people in. I'm going to need Sandy to help me hold it. I'm going to administer it. And Hilary's job is just to lie there and relax. The next step is getting a good lubricant. Now you can use Vaseline, but remember it's petroleum jelly. I'd rather put things like this in my car than on my body. What would be better is an herbal ointment, but today all we have is olive oil, which works wonderfully. The first step is make sure you get your fingers very well lubricated. What you want to do is find her anus, because that's where we're going to put the tube to make this enema work. Don't be shy, don't be modest. There's no time for that right now. This person is ill, we're saving their life, we're cleaning out their bowel. And this isn't a radical therapy. If you want to see radical, go to the hospital. The first thing we want to do is open her cheeks wide enough to find her anus. And when you see it, go ahead and put your finger in. Just slowly. Hilary, take a deep breath for me in and let it out. Good. And I'm just inserting my finger gently into her anus. We want to lubricate it, and this is also incredibly relaxing. You know, many body therapists said that this was the first chakra or the root of the energy for the human body. The bottom line is when you put a finger in someone's anus, it's very relaxing for them as long as they continue to breathe. And now I'm going to get a little more lubricant and do that again. And just breathe in, Hilary, and relax. And it's okay to rock the person a little bit. Be tender, be gentle, but we're going to have a high enema. How does that feel, Hilary? You feel relaxed? Good. Your job is just to lie there and keep breathing. Good. The next step is to lubricate the tip of the enema. Don't be stingy with your lubrication, especially since we're using olive oil. Put plenty on there. Now, to insert the tip, the first thing we did is we let water run through the enema hose to purge the hose of air bubbles. So it's filled with water now. The second thing again is I open her cheeks and I say, Hilary, take a big breath for me again. And as she inhales, I go ahead and put the tip in. Okay there? Good. And now we're going to start to let in the water. And Hilary, I just want you to continue to breathe for me if you would. And I'm just adjusting the flow with my fingers, just by pinching the hose. That works fine. And Sandy's going to tell me about the water. As I open it up now, I'm going to let a little water in, and we're going to watch that water level and see that it's going down. And it is. And Hillary, your job again is just to breathe. And the first time you do it, you may just fill the person's rectum with a cup of water, and they may have to get up and go to the bathroom. That's fine. It'll probably take 2 or 3 tries like this before their rectum is empty and you're actually going to introduce water into the colon itself, into that lowest part on the left-hand side, the sigmoid colon, where that's the first place you'll begin to feel this water. Now I'm going to let a little more in, Hillary. You feel that anywhere, Hillary?
Mm-hmm. In my
Okay. So I'm going to pull the towel here up a little bit. And Hillary, can you point to us and show us where you feel it? Right there. And of course you can see that that's right in the middle of her descending colon that we looked at before. I'm going to let a little more water in. Okay, you let me know.
Okay, I think now.
Okay, I'm going to stop this. I'm going to pull it out. Hang right there, Hillary. Just breathe. Breathe. Hang there. Okay, we got water up through halfway of her transverse colon. She felt some cramping, and so she went and voided that. Fine, that's what happens. Rarely will you introduce enough water to get to the person's cecum or appendix on the first try. It might take 2 or 3 tries. So we're going to start again. Big breath in, Hillary. And as she lets it out, I'm going to insert the tip. Good. And then I'm going to open it up for the water. And Hillary, again, I just want you to lie there, relax, and breathe. If you can, when you're doing that, it's okay to rock the person a little bit and give them a few nice squeezes. Sometimes even working on the feet a little bit or the calves can help the person relax that abdomen and take in more water. Water level going down? Good. And you tell me if you feel any cramping, Hillary, and at that point I'll hold the water off for a few minutes for your bowel to relax. How's that feel? Fine. And do you feel the water in the lowest part of your colon yet?
No, I don't.
Okay.
It's a little warmer.
We're using a little warmer water to relax her muscle. And of course we put a little lobelia tincture in it, and that lobelia again will stop the spasm and let us get in more water. I'm going to feel so I can see, I can feel the water there. Now in order to get that water into her transverse colon, I'm going to ask her to lie on her back. Now this is a little tricky. Hillary, I want you to slowly move over into your back, but I'm going to have you lift that leg up. Whoop. I said it was a little tricky. Okay, we have water now that's moved all the way up the descending colon, across the transverse colon, and now we're going to let Hillary down, and we're going to get the water over into her ascending colon and cecum by having her lie on what is her right side. Okay, Hillary, you want to come down slowly? Good, and just keep breathing. And I'm going to have you put this foot down while I keep the enema tip held in. Just go ahead and bring it down. Keep breathing. And then now I want you to slowly bring that leg up here so I can get this hose around. Perfect. And now just slowly keep breathing. Let yourself roll over. Wonderful. And just relax and keep breathing. And now, Hillary, if you'd move your head back towards the shower there a little bit. And now what we're doing is we're letting that water fall right down into the beginning of her colon, which is the ascending colon and the cecum. And I can feel the water there. Can you feel the water in you right down there, Hillary? And you can hear it. You can hear it. It sounds like a watermelon. She's full. And now we're going to turn off the water because she's cramping a little bit. Let her relax and breathe, and I'm going to keep her here and rock her a little bit to relax and breathe. Now I've shut this off. Thank you, Sandy. A couple things. If it gets a little smelly in the bathroom, again, we have our eucalyptus and our orange oil or whatever essential oils you want that will not only disinfect the air, but certainly make it smell a lot better. And also, don't forget, you have your cayenne and your lobelia tinctures. Always keep them on hand. Hillary felt a little faint earlier on the toilet. I put some cayenne tincture in her mouth and that ended that. She felt fine immediately. So always remember to keep that cayenne and lobelia tincture on hand. Keep breathing.